So tell us how you first met Dawn and what was your impression of her?
Let's see. How did I first meet Dawn?
I actually first met Dawn in 1997.
Early 1990s.
Late 90s.
I've known Dawn Cole for approximately 21 years.
She and I and several others went all over the southern part of the state teaching pediatric life support.
When we first met, I can just remember thinking, oh my gosh, I hope that I'm going to be like her when I grow up.
Dawn's a little bit goofy, okay?
Dawn Cole has actually been my supervisor, my boss, my mentor.
She's a very effective communicator because she's so genuine.
Some of the best and special things come in small packages. And that's what my impression about Dawn is.
She was just that nurse that did everything right.
I think Dawn's probably the only person I've never had an argument with.
If I have to describe Dawn Cole in one word, motivating.
Pollyanna.
Oh, let's see.
Nancy Nurse.
One word.
Fearless.
It probably have to be friend. You can put everything good about somebody into that word, and that's the way I feel about her.
Dawn is the only nursing leader I know who has gone from working with children to at one point working with women. She was over the OR, then she was over the orthopedic service line, the neuro service line. I think she was over every service line at our hospital at one point or another, except for cardiology. Of all the people that I know that are nurses or nursing leaders, Dawn has the most diverse background. My daughter will say, if you even start any kind of conversation about any career, Dawn's done that.
To a lot of people, nursing is a calling. For me, it was very practical. When I finished nursing school, I wanted to be a labor and delivery nurse. And about a day before I was supposed to start, they called me and said, well, the person who was leaving is not leaving. We do have a position in Green Unit, which was a surgical trauma ICU. The only clinical experience that I had had that I really did not ever think about doing as a career, and that's where I went to work. Working in ICU is scary when you're a brand new nurse, and it took me about probably 6 months to not be terrified every day, but it was a wonderful experience, and eventually felt like I took such good care of my patients that it had to be the place I was meant to be.
Dawn was one of the first nurses that gravitated to pediatric critical care. To take care of babies this big and get the drugs right, you don't have much room for error there, and so the nurses that do this get to be really good.
Dawn was a very capable pediatric nurse. If your patient had been in the unit for, a little while and their hair just didn't look quite right, she was going to make time to wash her patient's hair. And she expected the same of everybody else.
I often saw her share her expertise with young nurses, whether it could be just as simple as troubleshooting a bedside monitor or to complex issues such as troubleshooting a complex medication delivery system.
Sometimes we laughed about the details that she focused on, a piece of trash on the floor, an alarm going off that was too loud, a patient not being positioned right, just every little detail to make sure that that patient was really taking care of the best.
What we say are children are not little adults. Because if you're a person who takes care of adults, you think, well, I just need smaller needles. A toddler is not the same as an infant, and a 6-month-old is not the same as a 1-month-old, and a school-age child is not the same as a toddler. And it's not just mental development, it's physical development, it's how they grow, it's where their veins are best. Just things that you have to be a pediatric specialist to know that.
An adult system can eat a child. What's standing between them and getting eaten is that nurse with a sword in her hand, basically protecting a child from the adult system. If you look at a big hospital, there are all these specialty services, but if you look at the history of the evolution, just an MRI machine. To get an MRI, you have to lie there for an hour and not move, and children don't generally do that. So you have these specialty services beginning to evolve just to apply the services that came from adult medicine. Every one of those pieces of care, you've had to basically evolve a system within the system to do it.
A group of pediatricians in the community signed a petition to create a hospital within a hospital. And that's not just a floor, it's pediatric services. So it's looking for pediatric subspecialists, for a pediatric surgeon, for a pediatric ER doc, for those kinds of things that will help you build a pediatric hospital. That's how the hospital started to grow. In the early 90s was when we first opened our 6-bed pediatric ICU. Now we have a med-surg floor and a pediatric ICU and a neonatal ICU, but none of the real support services, and none of those spaces are together. We then were able to take over the 3rd floor of the medical center. We built a much bigger neonatal ICU. Then in 1995, we built the Children's Health Center. Now we had brand new pediatric residents, and they'd learn how to be pediatricians. Early 2000s, late 1990s, we were able to purchase Middle Georgia Hospital. Don Falk, who was the CEO then, called me and said, we're going to put children there, and you're going to move your PICU, and you're going to move your med-surg, and you're going to at least have those spaces together, which was wonderful. But we still didn't have a pediatric ER. We didn't have a pediatric OR. And if you really want to provide the best care for children, you need people that know about children and want to take care of children, and the place is designed for children.
Anything that was happening within the hospital that had anything to do with anything about a kid, she was right in the middle of it, massaging it behind the scene.
She believed that children should not be brought in and put on papoose boards and held down for procedures, that there was a way to give them a light sedation so that they would not remember the procedure being done. Then they wake up and then they get to go home, and it's much less traumatic. And she was such a champion for that.
Dawn also built the Children's Health Center and just made access to care for children wide open for anyone in Bibb County and then all of the surrounding counties as well.
She made sure we were the first hospital in the state of Georgia to get that designation for excellence in nursing.
She's been hugely involved in Ronald McDonald House. One of the other units is Hope for Kids, which stands for Hematology Oncology Place of Excellence. And it was so important to her because she wanted those kids to be able to come and it be a one-stop shop and them not have to go far from home. That came to fruition because of her leadership.
Even though we moved the med-surg and the PICU to the Middle Georgia building, the NICU was still on the 3rd floor of the main hospital. The OR is still on the 2nd floor of the main hospital. The ER is in the main hospital. It's kind of confusing for people to try to figure out where to go. When Ninfa Saunders came, she was at a meeting that I was hosting with a group of neurosurgeons, and she said, I'm going to build a children's hospital. And that's all I'm interested in building. And it might not happen next year, but it's going to happen. Our foundation did a fabulous job of raising money. The community really wanted that to happen. Then we got the green light to really start going.
Anybody that knows Dawn has heard her say children need a children's hospital, and that was her passion, and that's what she truly believed in, and she would not take no for an answer.
We finally have a pediatric ER, a pediatric radiology services, 3 pediatric surgeons, the GI suite, we have the neonatal unit and the PICU and the med-surg unit and the intermediate unit all together. Talk about a dream come true.
As the Children's Hospital has grown, it's really been behind her, moving those barriers and those obstacles. And that's kind of her leadership style. She doesn't tell you how to do something. She says, this is what you want to do. Okay, let me help you figure out how to start it. And then she says, make it work, make it yours.
Everybody that worked with Dawn will tell you that if she told you she had a gift, it didn't mean it was a bow on a package. It meant that it was a new opportunity.
It wasn't just the work you did, it was your life's work for Dawn. People did not show up for shift work or a weekend. They felt like their work should make a difference at the end of the day. She never felt like physicians were one group, nurses were other group. She was collectively equal to everybody.
From the time they walked in the door until the time they walked out of the door, she wanted to make sure that it was the highest standard of care that it could be.
She was someone who wanted to build you up, and she wanted to help you develop.
To me, a legacy is not what you leave behind, but it's what you leave in people. With children, we have to dream of the possibilities, and if we as leaders don't dream of possibilities, they become impossibilities. So Dawn really guided us to dream.
She was an absolutely wonderful mentor for all of us.
When I stop and think about how, the people can come to me and ask me questions, I think, oh gosh, I learned this from Dawn.
She's not going to be walking the halls of Navicent, but she's a part of me in every decision I make to take care of her patients. So her impact is immeasurable, and she'll never know how many lives she has truly impacted.